Hi, I'm Sarah Song. I'm a third-year pediatric resident at the Johns Hopkins Children's Center, and I'm excited to share with you some research I presented at the Pediatric Academic Society 2026 conference titled Lactation and Maternal Factors Associated with Maternal Human Milk Use in Preterm and Very Low Birth Weight Infants. Human milk use is associated with numerous benefits for both infants and lactating parents. These benefits become increasingly crucial amongst infants that are born prematurely or with very low birth weight. They include lower incidence of serious neonatal comorbidities such as necrotizing enterocolitis, late onset sepsis, chronic lung disease, retinopathy of prematurity, and neurodevelopmental impairment. However, lactating parents of preterm and very low birth weight infants often have greater challenges in providing human milk than other parents. This includes perinatal maternal medical morbidities that contribute to delayed or reduced milk production, prolonged mother-infant separation while the infant is admitted to the neonatal ICU that requires a dependence on pumping to maintain milk production, and increased maternal stress and fatigue related to caring for an infant in the NICU. Our study was designed to investigate maternal and early lactation factors that are associated with human milk use at discharge in preterm and very low birth weight infants. We looked at infants that were admitted to our neonatal ICU between 2023 and 2025, and we found several lactation factors that were associated with which infants were discharged on maternal human milk, including earlier initiation of maternal milk expression, use of an hospital-grade pump for expression, earlier and greater number of lactation consultant visits, and earlier initiation of practices like oral cares and skin-to-skin or kangaroo care. It shows that there are many modifiable factors that we can address in our clinical practice in our neonatal ICU. And this emphasizing importance of early lactation consultant support to establish maternal milk supply and earlier implementation of practices like oral cares and skin-to-skin care to promote bonding and family-centered care. We found that these babies that were discharged on maternal human milk had a shorter length of stay in our NICU, as well as a lower incidence of neonatal comorbidities such as retinopathy of prematurity. We also saw that there were socioeconomic factors like race and lower area deprivation indices that were associated with which babies were discharged on maternal milk, which supports the growing literature that recognizes disparities in maternal milk provision in both preterm and very low birth weight infants, as well as within breastfeeding overall. I want to thank my colleagues who helped put together this research. Thank you so much for listening.